Go ahead.
Good morning, my name is Alyssa and I'm going to be presenting on Parkinson's disease. My teammates are Cassie and Jillian. I put the 5 stages of Parkinson's disease up here because I just thought it would be a great way to talk about the development of the disease. In stage 1, there are mild symptoms. There are tremors, which are like shakiness. They usually don't interfere with daily activities. In stage 2, there are worsened symptoms. This usually has some walking, and then some walking, some bad walking, like a bad gait, I guess. But they are usually affected on both sides of the body. In stage 3, the main symptoms worsen, and we'll get to the symptoms later. There's a loss of balance, and there's slowness in the movement of the way your loved one walks. In stage 4, there's a severity of symptoms that require help, and the patient cannot live alone. So this is where they usually live in an assisted living or in a nursing home. In stage 5, the caregiver is needed for all activities, and the patient may not be able to stand or walk, and they may be bedridden. But keep in mind that this disease does occur slowly, so this does not happen over like a week's lifespan. For the symptoms and assessments, the symptoms for Parkinson's are different for everyone. They have resting tremors, so when they sit, they kind of shake a little bit. But there are early signs that may go unnoticed, or they are super mild. So it could be you are a little clumsy at the beginning of this. So that usually is ignored sometimes. So that could be an idea of a mild symptom. This usually begins on one side of the loved one's body. And the 4 main symptoms are resting tremor, which usually is on one side. And then there's bradykinesia, which is a slowed movement. And there's cogwheel rigidity, a series of little jerks when passive stretching occurs. So when they stretch, then they just like really shake really, really hard. There's also postural instability, which is a fancy way of saying that their posture is not very good. They might become stooped, which could lead to bad balance problems. There's also a loss in automatic movements, or there are speech changes. I have a resident back home, and she speaks very softly and very slowly. So this would be an idea of a speech change. So we try and help her to speak up louder. So we'll tell her, sorry, we can't hear you, and then we'll make her talk a little bit louder. This doesn't always work, but it just helps her to focus on with a good speaking voice. Some causes, this is going to be a long one, but I'm just going to read it. So it's a degeneration of the substantia nigra in the basal ganglia and the midbrain, leading to a depletion of the neurotransmitter of dopamine. This is basically just a fancy way of saying that there's a decline in the way that the brain sends signals throughout the entire body. The cause is unknown, but there also could be hereditary or environmental exposure. There are 2 classes. The primary class is idiopathic, which is expected to be hereditary. And there's also a secondary class, which is the iatrogenic, which could be environmental exposure. This could be related to the use of well water, living in a rural environment, and the exposure to pesticides and toxins. So theoretically, if your grandparent lives in Iowa, they could have these causes, but it may not happen everywhere. There's also potential evidence for protection of the basal ganglia in the midbrain from caffeine and smoking. So I'm not necessarily saying that you should drink coffee and smoke, but there is a little bit of a correlation. This usually is common in older adults 60 and older as well, and they're more likely to get it. For the diagnosis, the doctor will diagnose based on 2 out of 4 symptoms. So I just reposted the 4 main symptoms. So if your loved one has bradykinesia or postural instability, they could be diagnosed with Parkinson's disease. There are no tests for it. It really is just based on these 4 main symptoms. For treatments, there's no cure, unfortunately, for Parkinson's disease. Exercise helps slow the disease as best as it can, but as the disease progresses, it does get harder to keep movement going. There is a new deep brain stimulation surgery. It is the most important therapeutic advancement since the development of carbidopa-levodopa. Carbidopa-levodopa is a medication that is used to help slow the motor skills. It just helps keep them calm and restful from their movements and their tremors. In the deep brain stimulation surgery, there are electrodes that are inserted into a targeted area of the brain using an MRI, which is a fancy imaging system, and it records brain cell activity during the procedure. It is pretty painless for your loved one, and they are sedated, so they won't even feel it. There is a second procedure done after that placement is finished. They will do a implant of an impulse generator battery, or an IPG. It is basically like a pacemaker but for the brain. It's placed under the collarbone or in the abdomen, and it just helps control the function and the movement of those motor skills that are slowed. This is elective, so if your loved one does not have the right criteria, then they may not be able to qualify for this surgery. But keep in mind that this disease there's no cure, but it is manageable, and we can do our best to treat the symptoms as well. But most common is carbidopa-levodopa, and my resident back home, she takes it 30 minutes before she eats, so it'll help her slow her tremors so she can eat better. Because when you are super shaky, it's really hard to get food to your mouth, so. For the prognosis and follow-up, just understand that your loved one has to take all their medications at a certain amount of time, so just the management of that is very important. Healthy eating is a great idea too, with high fiber and lots of fluids. Exercise as best as they can. It may be difficult, but just a quick walk around is just good enough. So, but understanding that this disease is manageable is very important. Avoiding falls at all costs. It can be very, very hard to bounce back from a fall as we were doing in the older generation. Standing up straight is very important. Focusing on balancing, and just being there for emotional support. This is a chronic disease, so they will have it for the rest of their life. Sometimes an antidepressant may be prescribed if they really are having trouble just getting out of bed for daily activities and things like that. Joining a support group is also a good idea, or talking to a mental health professional, because this is a chronic condition, as I said. So talking to a mental health professional is a good idea as well. Thank you for listening. Have a great day.